Oh.
So we have Lenny here today. He is a creative director in healthcare advertising, self-employed, like freelancer, right?
Freelance, correct.
Yeah, okay.
Yeah.
And what do you want to look at today?
Well, I have a couple of issues. One is an ongoing issue, sciatica on the right side. I've been trying to deal with it with yoga and stretches, and I thought I'd get a professional opinion about it.
Okay, how long has that been bothering you?
Oh my gosh, since the early 90s.
Okay, long time.
Long time, on and off.
But it's not hurting you every day of your life, right? It flares up?
It flares up, and it can be very uncomfortable when it flares up because sometimes, I'd wake up and there's soreness, and I'd have to get up and stretch it just to get back to sleep.
On a scale of 1 to 10, do you feel it today? 10 would be I really feel like I'm in a lot of pain. 0 is I don't feel it at all.
Today, it's pretty good, but I always have the feeling that it's there. And like I said, it goes up and down, it flares, and sometimes it's okay for months.
Okay. So on a scale of 1 to 10, what would you say to this today? Like a 0.5 then?
Yeah.
Because you have an awareness.
Yeah.
Like almost like a shadow of it, but it's not creating a symptom in a way.
No.
Yeah.
It's very manageable today.
Yeah. I forget the name of that type of symptom. The word coming to mind was like a prodromal, like with herpes, for example. This is not herpes, but with herpes, you'll feel it for 2 or 3 days. Let's say you're going to get a herpes sore on your lip.
Right.
You'll feel it. It's not evident. You don't have a symptom yet, but you just kind of feel it coming on.
Yeah.
And it's not the same, but in a way, like people can have a pain like their knee or their back or their TMJ or whatever, or even a headache. And you're like, oh shit, it's coming on now.
Yeah, especially when you live with it for 30 years, you get to know it.
Yeah. But hopefully it just stays like a sleeping giant and never wakes up. But anyway, I forgot if someone knows, leave it in the comment. And I apologize, I don't remember that shit anymore. But,
Google it. Let's Google it.
Yeah, but we could Google it. So go ahead and lie face down.
Sure.
Oh, so you had lower back. What else?
Yeah, and then recently I've had a strained calf that's been problematic. I've had it for over a month, and it's not really completely going away.
Do you feel that today?
I do feel it a little bit.
Okay.
I like to run. It was feeling pretty good. I went for a run yesterday. It felt okay. Then when I woke up this morning, I feel the grab.
Okay, and then pull up your pant leg as high as you can. If you can get above the knee, that would be awesome.
Oh, sure.
Perfect.
Yeah.
And then what
right
else? Where is it? Outside edge?
Yeah.
Yeah, okay, I'll find that.
Right
You're
here.
going to wish you didn't show it to me because it's nasty. What else do you got?
That's about it. Next from computer.
Okay. So go ahead and lie face down. You're pretty tall, so I'm going to put you up this high on the table.
Cool.
I've worked with a lot of calves because I take care of a lot of dancers. I take care of a lot of Rockettes from New York City Rockettes. And I also, for, 19 years now, I'm not on staff with them, but they trickle in every year. And I usually see 10 to 12 Rockettes a year. And then, the seasons change and new ones come in and old ones retire. I don't mean old, but they do 5, 6, 8 years and they might not be with the company anymore. But I've been, my name gets passed down from each group, so I've been with them for a while.
That's
and
cool.
Same with American Ballet Theater, but they'll come in and say, from all this repetition, my calf is killing me. Or ballerinas, when they're on point, their calves get really worked. They're pushing and pushing and pushing and jumping and leaping and leaping and leaping in the calves. But do you feel this on the outside panel here?
Yes, I do.
Okay, so I do a lot of this during the day. It's not the most exciting thing to videotape, but it really is helpful because if you can find some of these knots and work them out, and I'm going to move your foot as I do. Actually scoot down a little bit so I get more range of motion on the foot.
Here we go.
And this should hurt a lot.
Yeah.
Because calves always are tender.
There we go.
So I think I'm on one of the bad spots.
Yeah.
And so I'm on the lateral aspect of the calf. I'm about almost at the midpoint down.
Yeah.
And this is just really tight. I don't feel you pulled anything as much as it's just seized up on you.
Yes.
And a couple of reasons. One, it just has a different texture, a different feeling when but you'll also get, if you really tear the muscle, it'll bleed. It'll bruise.
Yeah.
And so this feels like a wicked cramp.
Yeah, it is.
That never went away, like a chronic muscle trigger point. And it feels like a golf ball type of tightness.
Oh, yeah.
Ooh.
Oh, yeah.
So I'm coming in pretty strong. But I'm trying to work this out. I'm trying to dig it out. You know, if I just did this today, like this,
Yeah.
flutter my fingers, nothing's gonna happen. So I have to really dig it out.
Oh my gosh.
And so now I'm gonna use the edge of my elbow. And now point your toe. And you can't, right? And then bring it back again. And then point it again. And then bring it back. So this is a spot it's really hard to self-massage.
Yeah.
So it helps if someone digs in a little bit.
You know, I've been using some electrotherapy. I got one of those electrotherapy.
Yeah,
machines
like
that says-
stim or TENS unit.
Yeah.
Ooh.
I mean, that's been helpful.
And do you feel this above the knee right here? A little bit or not so
A
much?
little bit, just
Okay.
a little bit.
All right.
But it starts there, then it goes. Yeah, Mamma Mia.
All right, listen. Let's
Yeah.
go on to the back.
Okay.
All right.
Wow.
So I'm sweating. I don't know if you're sweating, but I don't have to go to the gym today. Not that I was planning to. My big workout today was I get those city bikes, you know, the bikes you can take out with your credit card. Although I have a year plan, and I rode over from Brooklyn to New York this morning.
Oh,
So it's about 30 minutes, but it's a good ride in the morning. And it wakes me up. So what I'm looking at is, and it's your right leg, right? It's your right
Yeah.
side.
Right.
So the legs are even in this position. I expected it to be off, but it isn't. But he said, you know, he's not symptomatic today. He's not having a problem. Take this leg and lift it high in the air like this. Good. So glad I got my head out of the way. Do it one more time. Do it again. Let's see what happens. And when you do that, do you get any tightness in the back?
a little bit, yeah. Right.
Point to it. Oh, through the glute. Okay, right in there. Okay, so put this down.
And then right here, on this ball joint,
Yeah.
that's kind of like where the most of the pain.
All right, so drop that leg so it relaxes. So I'm going to use a tapping instrument,
Okay.
and it's a adjusting instrument called the activator, and it
Yeah.
literally moves the bone, but
Oh.
a little bit.
Yeah.
You know, it's not a big popping, cracking technique. We don't have to twist the body. But do you feel this right there?
Oh, yeah.
You know, it's interesting. So what I'm feeling on top of the hip crest there is a knot that your body kind of formed over the last 30 years
Yeah.
that I don't feel on a lot of people, but
Yeah.
the body probably did it to stabilize. And now it's just a wicked knot. I'm going to look at that a little closer in a second.
Yeah.
But just out of curiosity, lift this leg up again and see if it's a little looser.
It is a little bit.
A little bit. Okay, drop it down. We're still going.
Yeah.
And
Oh, there's something right there.
yeah, I'm finding some good spots in you. Look at that one.
Oh, boy.
Right? That one.
Didn't know that existed there.
Yeah, this one. Look at how crazy that spot is. You feel that?
Yeah. Wow.
Okay. So now I'm going to pull your shirt up. Do I have permission?
Yes, you do.
Okay. Good. You always have to ask both men and women. You don't just yank their shirt around. But men too. You know, it's not, I think you have to ask everybody these days.
You do.
You might not want to show off your shredded lats and muscular physique without me asking, right? How about there? Do you feel that? So I'm a little higher up than you'd expect, but it's because that's where some of the referred muscle tightness goes, you know. And now here's that spot I was feeling before. So here's the hip crest. You can see it if I pull the skin away. So here's the hip crest, right there. And then just above the hip crest, right in here, and I'm going to climb on the table. Just above here is this knot.
Yeah.
I'm going to just dig it out with my elbow for a minute, like that. That should kill.
Yes.
Now lift that leg. Lift that. Do you feel how I'm on it?
You are
Okay.
on it, baby.
Yes. So now put that leg down.
Wow.
There you go. That was a big pop.
That was a good pop.
Whew. Okay. I think I'm going to go
Wow.
relax for a little bit.
I don't know who's more beat up, me or you.
I'm beat up. So next thing I'm going to have you do is lie on your side facing me, okay?
Wow.
All right. I might let you pull your pant leg down at this point. Okay, so pull this knee up like this.
Yeah.
And this is the side I'm not as interested in because you're all on the right.
Yeah.
But I just want to feel this side.
Okay.
So I don't expect anything to happen on this side, but let's just loosen you up a little bit.
Okay.
Plus, I'll learn something on this side.
Yeah.
Yeah. I just want to feel what it's called like joint play or joint spring, the spring of the joint.
Yeah.
So like if I took my thumb, like how much mobility is it? Is it springy? Is it loose? Is it super tight?
Yeah.
And the best way is not to compare you to another person, but to compare your left side to your right side. Now, we did the left side first, which is his good side, relatively speaking. Let's go to the other side, which is the involved side, or the side that he's had symptoms off and on for 30 years. And, but I already have like a little sense of what his joints move like. And they are a little tight, but I don't know how old you are, but we're probably about the same age. And, but the same person when they're 20 is going to be a lot more flexible and loose than they are at 30, 40, or 50. Good. One more. Good. Now lie on your back.
Okay.
I didn't hear a pop there. Did you? Maybe.
I didn't hear
I
anything.
didn't hear it. That's okay. Move towards me. Now here's the thing about pops. You know, crack and pop. Sometimes a body cracks and pops and everybody feels amazing about it. The chiropractor is excited and the patient's excited and it sounds great. And sometimes it is great and sometimes not much happened except a big release of air, but you didn't get a shift and change in the alignment. So sometimes I'm not that excited about a pop because it didn't really do anything.
Right.
Other times I like when it pops and does something, that's the best. Or sometimes you get a change in functionality, symptoms, and alignment with no pop. I'm excited about that too because that's results. So results get me excited. So that was a pop. Yeah, he felt that. Hands on your belly. I'm going to do a light one on your neck.
All right.
If it's there, it's there. If it's not, I'm going to leave it alone.
All right. Oh.
Good.
Oh.
That one you heard.
That was a pop.
That was a pop.
Wow. It was like firecrackers.
Nice,
Whoa.
right? All right. There might be one left on this side, so hang in there.
Yeah.
Relax that muscle.
Oh.
Here's the other one. Look.
Are you kidding me? Holy cow.
All right?
I'm good.
All right,
I'm
good. I
a lot
want to
better
see
than
you
it
can
was.
speak. Did you see your deceased relatives flash before your eyes, or
something flat.
your great grandfather from from the
Generations
fatherland?
ago.
Come sit up. All right, you're done. Look.
Holy cow. Thank you, Doug.
Walk around. Let's see what the calf feels like. I don't know if you'll notice the difference right away.
That definitely feels better.
Yeah, right.
Yeah.
Feels better because I'm not killing it anymore.
You could probably use another elbow, but
Yeah.
yeah, this has been a chronic situation for like a month easy.
All right, man. Thanks for coming in.
All right.
All
My
right.
pleasure.
Thank you.